Thank you for postponing a little bit. She's in the room now. So, yeah, good morning, everybody. Good morning, supervisors. Thank you for having us again to update on the COVID situation in the county. So, I'll give a quick little overview, and then Sarah can do the data. Right now, the cases are falling significantly locally and around the state. The hospital situation is very good at this point. We are concerned about the variants. There's some seems to be spreading. We're not sure exactly what it means yet, but looking at different places around the world, Brazil and London are two places where it's very concerning. It seems to be spreading rapidly, and there are some concerns that we're going to see significant surges in the future from this. We had been feeling pretty good about how things were going to be unfolding in the next couple of months, but that may be changing. We'll have to, we're just waiting to see how that goes. We continue to be in the purple tier, and we can talk a little bit about that later. And but why don't we go into the data with Sarah now?
Good morning, everyone. May I share my screen?
You should be able to do it now. Sorry about that.
Thank you. Like Dr. Pace said, we are seeing a declining case rate, which is really exciting coming off of our peak over the Christmas and New Year holiday. We'll start at the state level though, and the state is seeing similar improvements. So on the left, we see at the state level, the testing remains high, though it has increased in the last couple of weeks here with this dark blue line, which is the 14-day average. This is really promising news that we see on the right. The decline in the testing positivity is down to 7.3%. It was near 15% just a couple of weeks ago. And while testing remains high and we see this dropping, tells us the level of transmission in the community is dropping. And here is our epi curve looking at the number of new cases over time. Here you can see the peak at the statewide level, and just about as rapidly as we saw an increase in cases, we're seeing a very rapid decrease in the number of new cases, down to about 15,000 new cases reported yesterday. And so if you'll recall, we were looking at double that over the month of December. Correspondingly, we've started to turn the corner here, and the number of COVID hospitalized patients down to about 15,000 statewide. Yesterday, again, we were seeing over 20,000 COVID patients. So again, really promising signs. Here in Lake County, I've seen a similar trend to the state. We started to, I'm not going to say bend our curve yet because we just have a couple weeks. We're a little bit behind the state, but we have seen a decrease in the number of new cases identified by week. So as yesterday evening, we've identified 117 new cases. You can see our peak here, these 2 weeks, whereas the week beginning to January 17th, we saw 90 cases. And so this week is what makes up our new tier assignment that the state will release today. And then this week of January 24th, the week we just finished, we've identified 89 cases. Now we'll continue to identify new cases throughout this week, so this will increase. So it's really critical, it'll be really critical what we see over the next couple of weeks, but we do seem to see a decline, though I expect we'll see more cases in this week than we saw the previous week. Like Dr. Pace said, we remain in the purple tier. The state will make the official announcement at noon. Our case rate remains in the purple or widespread tier at 21 per 100,000. So while we're still in the purple, the good news is I think last week I reported about 40 per 100,000, and it was close to 60 a couple weeks prior. So it is declining even though transmission remains widespread, and our testing positivity has dropped significantly to about 7%. And this is dropping into what we call the orange tier or substantial transmission. So this is really good news. We'll remain in the purple tier because of our daily case rate, but we're coming back towards what we were in the fall. And most of the state, like Lake County, remains in this purple tier, but most communities seeing a fairly dramatic reduction in transmission. And just a look at ICU capacity. So there has been a decrease, just like we've seen in total hospitalized patients and ICU patients at the state level, down to about 4,000 yesterday. And you can see this line here, we're starting to see an increase in the number of ICU beds available statewide. Just to look more locally, in Lake County, still seeing 6 to 7 of the 8 ICU beds occupied on a daily basis. From 1 to 2 COVID positive patients to 3 or 4 or 5. In Rancho, about 9 to 21% of the ICU patients over the last week have been COVID positive, and about 90 or so occupied ICU beds daily. So looking okay on that front as well. And unfortunately, we've had almost 4,000 new COVID people. We've had almost 4,000 people die of COVID in the last week since I last reported to you, almost to 41,000. As we've seen the number of new infections decline, we'll start to see this dark black line decline, but we have statewide experienced about 4,000 new COVID deaths over the last week. And what is, as everyone knows, so critical in this moment is the number of people, or how rapidly we can get vaccine administered to people who want the vaccine. And I'm showing you here new data looking at people residing in Lake County who have received at least 1 COVID vaccine dose, and when they got it, what week they got it. So we estimate that about 5,800 people in Lake County have received at least 1 COVID vaccine dose as of last night, and this is about 9% of the county population. And next week, or whenever we share the data again with you, we'll bring additional information about some of the demographics, so the age of people and where they're living in the county who have received the vaccine. So I'll end there. Dr. Pace, would you like to say anything else on the vaccine slide?
No, that's great. Thank you. Yeah, go ahead and you can unshare. Yeah, thanks. So, I mean, I think a couple of the things that are worth noting there is, one, the case rates at about 21 per 100,000. And one of the really important things about that is that the schools can begin to start opening when we're under 25 for 5 days in a row. So we're just starting to approach that point. So the schools that have not been open yet, if they have their safety plans in place, they are allowed to be open there. So I'm sure we'll be in a lot of discussion about that. This came quicker than we expected. It's really dropped dramatically over the last week or so. So we had started talking about that a few weeks ago, that this will be coming in the coming month or so. We weren't sure when, but it looks like it may be right around the corner. The other thing is that we're not at the red zone yet, but it's not completely out of the realm of possibility now that we could be there in the next couple of weeks. And if everybody remembers, that was where we spent a lot of the summer and the fall, and that was when you could have some indoor dining and some other indoor activities. So that may be coming now. So I encourage everybody to keep looking at it. Again, this variant situation is a real curveball. So we're not sure exactly how that's going to impact things, but at least at this point, the trend seems to be very positive and going in the right direction. One of the things I just want to emphasize now is that taking the same precautions is really important. With this variant, it's actually more transmissible. So the things we were doing before, we need to actually be more careful about than we were before. And one of the things people are recommending, that the CDC and other places are recommending, is considering upgrading your mask. So doing a second layer of mask, or wearing a surgical mask underneath a cloth mask. So these things are probably will increase protection, and are probably a good idea to do at this point. So the surge was something we were very concerned about for 4 to 6 weeks there after Christmas. And The situation locally is stable. Over the last week or so, there have not been significant problems with getting people out of the hospitals or getting transport to out of region hospital beds. So this is very good, and hopefully it continues. The vaccine is the thing that we really wanted to talk about today. First off, we'll just talk about the numbers. Like Sarah showed, it looks like somewhere over 5,000 people have gotten their first dose of the vaccine here. Most of that is coming either through the health department, or we've shared some of our vaccine with some of the local clinics, or through Sutter and Adventist. Sutter and Adventist each have their own supply chains coming in, and they each did like 1,000 last week. The health department did somewhere in that same range. So we are moving forward. All the vaccine we're getting is being used, and we're moving forward as quickly as we can. Second doses have begun, and we're starting to do those as well. People that have gotten the first dose should be getting, through the health department anyhow, should be getting contacted for a second dose appointment if they don't already have one. With the sites, we've been using these two stand-up sites, and Southern Adventists have had a variety of different options that they're doing. We're starting to think we probably need to move towards a drive-through site. So we're starting to shift the plans a little bit and starting to look at some of the possibilities of a drive-through. Again, the biggest issue with the vaccine is the amount of vaccine coming into the county. We've got 800 for last week, 800 for this week, and we're waiting to see how much we get in the coming weeks. Still very low amounts, but with the amounts coming in through Southern Adventist, that's really helping, and they have different supply chains. So the state now is starting to hint that they actually are going to have less available in the coming weeks. We're not sure what that means. They had been kind of insinuating that they were going to be getting more in February, but now it's not looking as, they're not nearly as optimistic. So we're not sure how much it's going to be, and we wait for our allocation, and we're talking with different people all the time about how to get more, but all of the 58 counties in the state are in the same boat. We have continued to focus on the school staff and the senior population. And we're going to talk quite a bit about some of this because I know there's a lot of concern about that. The teachers should be finishing this week in terms of getting offered the vaccine and getting them the ones that wanted them. And the seniors, we continue to work with them. We're calling them through lists off the senior centers or some of the medical providers in the community, trying to target the most vulnerable seniors first. And so we again encourage people not to call the senior centers. They are reaching out off these lists of the Meals on Wheels and other ways that they're identifying who are the most vulnerable people. And currently there are still no appointments available to the general public. There's no number you can call and get an appointment. We are working off these lists so that we try to get the right people to the front of the line. Some providers do have vaccines, so some of the clinical providers in the community and Adventist and Sutter. So those are, sometimes you can get appointments through them. As Safeway has also, we've supplied Safeway with some vaccine, and so they've been able to do a certain amount of people as well. So I wanted to talk about the tiers, and this is the way we're prioritizing the people to get vaccinated. So since there's a limited supply, we want to try to work off a timetable to get people vaccinated in some kind of reasonable order. If you look around the country, around the state, there's a lot of these situations where people have been waiting in line for hours and hours, or the websites crash because everybody's trying to get on the website. And the way we've decided to do this, at least at this point, is trying to determine some priorities and then contact people on those lists and get them appointments. Imperfect system for sure, and pretty labor intensive, but it's been a way of trying to manage this going forward. Been getting a lot of criticism lately about the way these decisions have been made and lack of transparency and why some people are in the front of the line than others. And so I was going to spend a bit of time today going over that. But one of the solutions, because I've been the one that's basically making the decision, I've been working off of the state guidelines, and the state guidelines are a little bit ambiguous. And so there's always some judgment that's being made on that. But we are talking about creating a group to help kind of advise about this. So Carol might want to talk about that a little bit.
Yes, thank you, Dr. Pace. I'm grateful to be able to work with you to support some of this, and following the model being used presently in some other counties, we're putting together the COVID-19 Ethics Ad Hoc Committee that will focus on helping to prioritize vaccine in Lake County. And so here is an overview of how that committee will function and what its purpose is. It will advise you regarding ethical matters involving the distribution of vaccines in alignment with the state and federal guidelines. The committee will be advisory in nature. And while it is expected that the committee will vote on its recommendations that will be taken under consideration by you, the committee recommendations are not binding, although nonetheless really helpful. The need for this committee is pretty simply put. The local need for vaccine is too great for the number of vaccine doses that are being allocated by the state, and so prioritization is needed. And in addition, from time to time, special circumstances arise, promoting the need to reconsider the prioritization in order to avoid or manage an outbreak in certain priority groups. So we have drafted some ethical principles for this committee. This draft would be pending the convening of the committee and the committee weighing in and adopting these or any reasonable variation of these. But the intent of the committee is to achieve maximum community benefit by optimally protecting the health and well-being of our citizens. And we're referring to both socio and economic well-being. To ensure that each human life is treated with dignity, worth, and value, to mitigate disparities in the disease impact on different populations, to ensure fairness and impartiality, to act transparently, and to make decisions based on the best available evidence. We have invitations pending to a number of local representatives in these groups. The Latino and Native American communities are here because, as it's well documented, there is a considerable amount of disparity with respect to the virus impacting these community members. Also a hospital representative, primary care clinic representative, a representative of the agricultural industry, particularly with ag workers in mind, a business representative, and an at-large member as well. We'll convene this committee on an as-needed basis, and I will support that process along with Lake County Public Health staff. And the initial task for this committee is to establish and confirm its ethical principles, something along the lines of what we've drafted here, and then also to review and make recommendations on the existing plan, which Dr. Pace is about to show you here in just a couple of minutes. And then, of course, on an ongoing basis, to address those situations that come up that prompt a need for change in the prioritization plan. So that's what the committee structure is looking like. And I'll stop sharing this screen. And Dr. Pace, when you're ready, I can share the plan itself as it stands.
Okay, yeah, so thank you for that. So basically what we're trying to do is to kind of make this decision-making process a little more robust, especially since there's been a lot of concern in the community about how things are getting rolled out. What I wanted to do here is talk a little bit about what the state's doing, and then we'll show the plan that we put together a month ago and submitted. And so just to show how we've been working off this, and then updates. So to show what's actually happened. So, you know, these plans get put in place and they don't necessarily get followed through on. So just show you what's happening. Basically, the state now has put out these phases and tiers, which I've talked about some and which are available on the website, and we'll be walking through this. But the idea was to really focus on the healthcare workers and the emergency workers to keep the system going during a surge, because if you saw what happened in New York, it was very concerning, and we wanted to try to keep the hospital people and the ambulance drivers safe. So that was, and the nursing home safe. So that was one of the first parts. And the second part was in phase 1B, tier 1, was essential workers and elders. Initially, it started at the 75-year-old, and then they expanded it down to 65-year-old. The problem is we don't have enough vaccine to get all those people. So we're trying to prioritize, and I made the decision to prioritize the teachers and the school staff so that we could get the schools open as soon as possible, because that was, to me, one of the priorities for society, to get the kids back into school before the end of the year. And anything we could do to support that was part of the plan. So the state now, and then there were further tiers with essential workers. The state now is coming out probably today with some new guidelines. So they've kind of changed course again, which is something that's kind of keeps happening, and we're working with it as best we can. I think partly what's happening is it was too complicated, and they feel like it's causing too much confusion. And also, I think they're getting concerned about these variants and the possibility of another surge coming in the near future. So they really want to focus on an age-based approach and remove the work-based categories, the sectors, so that the older people can get, the people that are more likely to die, basically, are going to be the ones that will be the first to get vaccinated. So and the timing of such is we're really trying to get vaccine out as quickly as possible now, because these variants are moving around. The more people that are vaccinated, the less it'll move around. So that's part of the backdrop of the strategy. But we're going to keep some of the things in place, and the state's recommending that as well. So if you could go ahead and put that up, Carol, I can
Sure.
kind of
So
walk
I'm about
through
to
it.
put it up, and I want to give a caveat here. It is a table, and it has some page breaks in strange places that I couldn't get out. And so I apologize for that, but I'll just try to move past them when we come to them. So on your screen, you should be able to see phase 1A, tier 1. And Dr. Pace, are you going to review it by phase?
Yeah, I was just going to go down. But so if you look at phase 1A, you can see the different, so basically what this is the plan that we submitted on January 4th to the state. And then the plan for vaccination, some of these I've updated a little bit, and then the project start date and some of the completion dates here. But so basically, phase 1A is essentially complete now. This is basically the hospitals, the clinics, the EMTs, the skilled nursing facilities, all that. These have been pretty much completed now. Everybody's basically been offered vaccine, and many of them have already gotten their second doses. There's probably a few small practices in the community that have fallen through the cracks, and if they're still out there, they should contact us and we'll get them in. So, but you can just kind of go ahead and scroll down a little bit. All the nursing homes have been, the residents have been vaccinated, and the staff that have been interested in it have gotten vaccinated. So then you go into tier 2, the intermediate care facilities. Orchard Park had the pharmacy come out and do that the other day. Home health, we've focused with home health and in-home supportive services on the folks that are moving amongst different houses. So the state's going to come out with some new clarification about this, but there's been some confusion about that. But really what we were trying to do was to, the workers that go from house to house and see different patients, we wanted to try to prevent the spread that way. If somebody's taking care of a family member, they were not considered a huge, as high a priority as the folks that were moving through the other houses. So, so you can keep going then to the next one. So this is one of the page breaks with the tiers. So the community health workers, yeah, keep going. So then we get to the public health field staff, primary care clinics. All those have been completed at this point. And then the other, you can keep going. These other clinics, these are specialty clinics, lab workers, dental clinics, pharmacy staff, other folks like that. They've all been offered it now, or if they haven't been offered it. We've tried to reach out to everybody, but if we haven't gotten to everybody, they can contact us and we'll try to get them in. So again, the idea here was with this first phase was to cover everybody with that's in the kind of the healthcare community so that we could keep the system running as the surge got worse. Now into phase B, this is where it gets, this is where we are right now. We're in 1B, tier 1. And the way this is the state, this was the way the plan was initially written a month ago. So 75 years and older, but then the governor changed it to 65 and older. So we've been focusing on the most vulnerable in the community through the outreach we've been doing. And we're moving along, but there's still a lot to go. There's in the 75 years old and older group, there's 5,700 people, I think, in the 5,300 people in Lake County. And in the 65 to 74-year-old group, there's 9,000. So, you know, there's almost 14,000 people in this age range, 65 and above, in the county. And so, you know, you can see that it's going to take a little while to get all these folks done. We've done maybe 5,800 in the county, and that's including all the healthcare workers and most of the school staff. So we still have a ways to go, but we're working hard on that. And these are the folks that the two hospital chains are particularly good at getting. So we are continuing with that group. And again, focusing on the vulnerable ones. So sorry, slow down a little bit there.
Okay.
Yeah, go ahead and go back a little bit. So this is where the essential worker part comes in, and this is where it's gotten confusing and I think caused people some upset. Is that the food and ag community was in this list, and a lot of the idea was these are the essential workers out in the community. They're in contact with people at the stores or in the growing capacity, and also these are in the Latino community especially were particularly hard hit by the virus. And there's a real disparity here. And so part of the focus was on this. We have not started vaccinating these folks yet. I hope to do that in the coming weeks and to see what we can do with that. Education and childcare is next. And so this was a priority with the K through 12 teachers and staff. So that's really where the focus was to try to get the kids back into school. Childcare and colleges also were part of this in the state orders, but they've been able to accommodate better than the K through 12. So we really wanted to focus on them and so that we could get the kids back to school. And then emergency services are have a lot of those have already been done through the healthcare and the emergency EMS system, but those will be being done at the same time as this. So then if we go down, so that's the tier we're in now, and we prioritize some of it by age and by vulnerability and by the schools. So then we'll work with the rest of this tier. Then after this, basically, this was going to be the next phases that were going on, and we had all these plans. But now the state is really looks like they're going to change this around and sort of eliminate a lot of this and just go into an age-based thing. So probably 60 to 65 years old. Well, sorry, before that, the new thing that they're going to do is the underlying medical conditions, and they've got a specific list of underlying conditions that will qualify that the person's medical provider will have to do. But these are the folks that will be considered high risk if they get sick. So that will come next after the phase 1B tier 1. Then people with chronic medical conditions of 18 to 65 will be next. And then we will move into an age-based range. So all these other plans that we did looks like the state is going to eliminate, and we'll just go to age-based. So I know this is kind of confusing and it's a lot of detail, but I think it's important to see how we're trying to make these decisions and what some of the understanding is behind them. Really, the idea is to try to places where we were having big outbreaks early on, we were trying to vaccinate those people. So some of the congregate living facilities where the elders are together or people in different kinds of treatment capacities, but they're in a closed place and they can't leave, and the staff can't leave, that we were trying to get those people covered. And also age and the schools have been the priority at this point. So, every day there are decisions that get made. People call me all the time trying to advocate for their staff and things like this. And sometimes there's a vaccine at the end of the day. So sometimes we contact people with that, but generally this is what we're trying to follow. And I've tried to be very meticulous about following this, and the staff has been really good about it. And so that's just to kind of illustrate that. And I'm sure there will be some questions about that. But overall, we are moving along. We're getting the vaccine out as soon as we get it. I'm afraid there may be less vaccine in the coming weeks, but we'll just have to adjust the appointments. We are the vaccine sites working pretty well. And I think we're going to shift to a drive-through for a variety of reasons. And the surge is a lot better right now, but it's really not time for people to let up on their precautions, because this variant potentially could be a real problem. We just don't know yet. But if you look over in London or you look in Brazil, it's very, very concerning. And so I think that's all for me now. And but I'm happy to answer questions.
Thank you very much, Dr. Pace, for your update. Any comments or questions? Supervisor Scott.
I do have a question. Carol, can you bring that back up and go to the top? I'm glad, Dr. Pace, that you talked about those with underlying health conditions. I think right now that's one of my concerns, and constituents also have those concerns. But if you could pull that up.
The very top, Supervisor?
The very top, please.
Okay, let me find my little thingy here.
Because I know we have many in our community with underlying health conditions. If they were to get COVID, they may not survive, just like the ones that are 80 or 75 and older.
Maybe you need a little further down.
No, right there. No, down a little bit, or up, back up.
Okay, thank you.
On the tier 1 with the skilled nursing, you do have or medically vulnerable individuals. What would that include? Because I know we spoke about
what they're saying here is similar settings for older or medically vulnerable. So these are basically congregate living situations for medically vulnerable folks. It's not just medically vulnerable people in their homes. The idea is that certainly you're absolutely right. People with underlying medical conditions are very vulnerable to this. The idea is, though, is people hopefully can stay home in their place and not get exposed. And the caregivers can get vaccinated, especially if they're moving through different homes. But so it's trying to protect the people that don't have the ability to isolate and to separate from and protect themselves because of a congregate living situation. Those were the highest priority.
Doctor, there are a couple of other places where older adults are referenced in tier 2, and here's one. And then later in phase 1C, tier 1. So, and then there's the younger folks too, as well, that have underlying medical conditions.
Yeah. Well, I really appreciate the committee that you're forming, trying to figure out, how we are going to be getting these vaccines out. And I think that's something that committee needs to look at, is those that do have underlying medical conditions that may be able to isolate, but their caregiver may not be able to, and they have to continue going out into the community to work and then come home and then just have this fear that they're going to be bringing the virus home to their loved one that they're trying to protect. So I just really appreciate all the work that you're doing. And I'm glad that you mentioned that we will be looking at those with underlying health conditions. Thank you.
Thank you, Supervisor. Any other questions or comments? Supervisor Pyska?
I just want to echo my thanks for this committee too. I think it's really wise to have all the different components of our community that are being affected disproportionately. So I appreciate that. I've gotten this question before for people that are 75 or older and they don't have a relationship with a provider or the senior center. So would they call the pharmacy, or what would be the path that they would take?
Well, so these are people that don't have a medical provider?
Believe it or not, it's true.
Well, if you get those people, why don't you get a list and send them to me?
Okay. So if somebody that's 75 or older doesn't have a provider, they should contact their supervisor.
Well, again, what we're trying to do is to particularly focus in the beginning on the ones that are sickest and the most vulnerable. And this is really 65 and above. So those people tend to be plugged into the medical community. I mean, not 100%, but again, what we're trying to do is roll this out as fast as possible and get the most people covered as quickly as possible. So we're really focusing on trying to get large groups of people taken care of quickly. If there's some exceptions of folks that need it and they don't have a medical provider and they don't have any relation with the senior center, yeah, I mean, if those names can get to me, we can try to put together a list and contact those folks.
Okay.
If the best way is through the supervisor, that's fine. Yeah.
Okay. There is a community of people that use holistic providers and, have never reached out to a regular doctor. So I just wanted to make sure that they had a pathway.
Great.
Thank you, Supervisor. Supervisor Simon?
Yeah, thank you for the update, Dr. Pace. And I know, obviously, like I said last week, I think some of your own words, we're being optimistic as we look through the end of this thing. It's a long ways away, but want to, just once again, thank everybody in your department, all EMS, all of the folks with the county that have been working on this diligently, and just really focus on the supply issue. I think that everything that's being done, it's very encouraging to hear. We're using all the doses that we have, but it just continues to be that supply issue that is the real challenge. And hopefully that'll be figured out in the next 4 to 8 weeks. That's what we're hoping for. Obviously, as supervisors here, it is a priority for us to really do everything we can to contact our federal representatives, because that's really where the supply is coming from. To continue advocate for county, the county constituents and your department, to take the pressure off you guys as the supply increases. So we'll continue to do that. And I just want to let you know that here to support you in any way to help you achieve those goals. The other question I did have here for locally for the senior centers, just a question that came to me as a supervisor was, the staff that works at the senior centers. So I know we're working hard with the senior centers. Where would the staff for senior centers fall in that list? Because we do have folks that are coming in, still doing the Meals on Wheels, the drive-through. I know we have staff that works at all of our senior centers here locally. And it was just, I didn't know the answer, so I'm asking you.
Yeah, I think, well, these are the kind of questions that come up all day long, right?
Yeah. Yeah.
And it's, and for every person that you say, well, okay, let's give them, then somebody else gets squeezed out the backside. So it's, at this point, if they're 65 and above and they're vulnerable in some way, they would be considered able to get vaccinated. If they're younger than that, working at I think some of the drivers, the people that were going to the homes and were going into the homes were able to get vaccinated because they were kind of treated like in-home caregivers. But the folks that are working, preparing the food, that aren't really in contact with the community so much would not be moved to the front of the list.
Okay, I just wanted to, just for clarification, that's what I.
But again, these are the questions that having this committee will help, because literally all day long, I'm trying to manage these kinds of questions, and, sometimes I do it right, sometimes I miss. So it's.
Okay, thank you for that. I did not want to be speaking for your department. Obviously, I think the list that we have there is, like you said, changing daily. I know the state is having calls, and it's completely coming down to you as we move through this process. The next question I had on doses, the doses that we have for Lake County here, are we? We aren't holding any doses back, correct? Are we holding any doses back for the second doses, or are we getting everything out? That's another question that keeps coming up.
Well, so the ones that come into the health department, we are sending them on through because we're supposed to be getting second doses coming in from the state.
Okay.
Some of them we're sharing with some of our partners, like some of the clinics and some of the pharmacies. And, we're saying we think we're going to get a second dose. We're not exactly sure. They seem to be hedging a little bit. And so, if you want to guarantee that, so I'm leaving that up to each entity, how they're messaging it to people, because I have to say the state has been such a moving target with all these things that I'm not sure that they're going to be able to deliver on all the second doses that they say they are. So we're trying to work with it as best we can, and they continue to say that they will be doing that. But there's a lot of discussion now about whether to just get all the doses out right away, and we may not have enough for the second doses, but at least more people are protected. There's a lot of discussion going on at the state and federal level about that right now. But at this point, the general consensus is that the best way to do this is to go ahead and make sure that you get second doses for everybody that got the first dose. But I think if the variant situation worsens, that's probably going to change, where we just put all the doses into first doses. So at this point, we're basically getting everything out. That's we're not holding back. But it's it's very much a moving target.
Okay. The other thing, because always looking for one more or two more actually. One on the committee that's being put together, and I know we had the Latino community and we had the Native American community. Was there consideration in talking about our African American community here in Lake County being added to that list? Just a conversation. That was one thing that I looked when we talk about disparities. I think if we could add that just for a conversation piece here today with the board and with your staff. Hopefully we'll have some more conversation before we end this today. And then the other thing is, I know that especially here in South County, I know that some other medical providers, I know that a lot of folks that work over the mountain and other things have Kaiser or other out of area places. Is there anything going on with the public health group in the northern region and the medical groups to kind of share information? Because I imagine we've had folks that haven't gone through a vaccination through Adventist or through Sutter or through the public health department. They may have gotten it in another county they work in or something like that. Is there any sharing of information that's going on around our surrounding communities? Because the reason I bring it up is our vaccination level could be higher than we're reporting. Not much, but there could be some folks that we're not catching that may have gotten vaccine in other areas. Just a question. I know we're not adding extra work, not asking for that, but I just trying to pick out positive that could be happening with this vaccination.
Well, a couple things. One is we've got 9% of the population with the first dose so far. That's really good. That's better than a lot of places. And so just to find a positive, that's something that I think with the health department and with Sutter and Adventist working so hard to get these out there, this has been a real push for all three entities to get it out. So, and I think that shows. The second is with your question about the African American folks, we weren't, the numbers are low in Lake County, and we did not notice any kind of unusually high rates of cases, COVID cases in the African American community in Lake County, just from a data point of view. In other parts of the state and the country, that's not true. Those communities are getting hit very, very hard. But in Lake County, that doesn't seem to be the case at this point. So the conversation came up, but we decided to focus on the groups that were actually showing much higher rates of COVID in terms of focusing in this ethics committee. And then your third question, was about Kaiser. It was the data that Sarah showed is actually state data based on county of residence. So that would pick all that up. So
Okay.
the data sharing is very complicated right now, and there's a lot of problems with it, like Sutter and Adventist sharing how much vaccine they're getting and all that, because it's part of their corporate structure and they keep information, in a certain way there. But they've been very good about sharing how many people they've gotten vaccinated, and it seems to be correlating with what we're getting from the state. So I think that data is probably pretty good.
All right. Thank you very much.
Thank you, Supervisor. And just to add to that real quick, it's CARE, the California Immunization Registry, that every single person getting the vaccination has to be registered inside that database. And just like Dr. Pace said, it goes back to the home residents. Typically, similar to the testing and cases, we know if someone else got tested outside of the area, if that's a case for Lake County, if they reside here. Any further comments? Yeah. Dr. Crandall.
Yes, so Dr. Pace, it's thanks for the report, you and Sarah, of course. It's really relieving to see the numbers somewhat go down. Hopefully we can keep that pace going. I just had a question about in the vaccination portion of this discussion. You mentioned does that encumber health department, Adventist, and Sutter? Is that we, or is we just the health department? When you mentioned that,
in terms of the prioritization.
Yeah, because for example, in the report you mentioned that we have vaccinated at least 1,000 this week. Sutter did 1,000, and Adventist did 1,000. And then when you continued on about vaccination, you would say we. So I just making sure that if we is just health or if it encumbers Adventist and Sutter. That makes sense?
Yeah, I'm not sure specifically what I said that would, generally I probably was saying we kind of as the health department.
Okay. Yeah, so you guys, so the health department is bringing in the 800 a week, and hopefully we can keep that pace.
Right. Right.
And then Adventist, yeah. Oh, go ahead. Sorry.
Yeah, they've got their own supply chain through their corporate structure. Okay. And I don't, they have their own ways of determining how much they can get, and I don't really have access to that.
Okay. Well, hopefully we can ensure that this keeps trickling forward the same way, because that's the 3,000 a week after 10 weeks is half our population. I don't know. I'm really concerned because we have I know a lot of questions from different supervisors have mentioned that, that they're getting the questions, and I'm getting a lot as well. 64 and older, they're calling, and I've mentioned with you as well. Called with you and discussed how to get some people to the Mohawk or wherever the case may be. But with the numbers going down, hopefully we can start getting people vaccinated so this can start taking a turn for the better, for the better of everything. And I understand that, the numbers aren't showing highly in the situation for African-American families or Black communities. And I know we don't have a big population, but I still think it's important that we have them represented, if at all possible, like Supervisor Simon said. And I think that's all I have for now.
Thank you, Supervisor. I have a few questions, Dr. Pace. Again, thank you for you and Sarah's report. Glad to see that our numbers are doing well, and I think every single one of us who pays attention to the hub on our website has noticed that those numbers are not climbing like they were a few weeks ago. A few weeks ago it was in the hundreds. Now it's maybe around the 20s, just as you were saying, it's around 21 per 100,000 or whatever that number was. So that's good news, and hopefully we can see the trend continue to decrease. I want to ask some questions about schools. In the past, there's been the idea that schools was somewhat a split idea, where elementary schools would be treated differently than high schools or middle schools. You mentioned K through 12. Is there still a waiver system to be able to open under purple, even though we have met that threshold of, I think you said it was 28 per 100,000? Is it a waiver system? Is it automatically they can open? And is it all schools, or is it specific grades that can open?
So the waiver system is gone. That got eliminated. The schools need to put together a safety plan. And if we are under the 25 per 100,000 for, I think it's 5 days, and we're approaching that now. It's been for a few days now. So like if we continue like this by next week, that would be possible. They are allowed to open. There's not, they need to submit them to me. I have 5 days to raise questions or concerns. But if I don't do that, if I don't do anything, the school can open, and they need to follow the safety plan.
And again, it's all schools at this moment, not specific grades.
Right.
Okay. Just another question, which I believe I know the answer to. It doesn't matter if 10% of their staff has been vaccinated versus 80% of their staff. Does vaccination have anything to do with school opening, or is it PPE that's more of a direct correlation for safety?
Right. This is independent of vaccination. I mean, the idea was the more we could vaccinate people, the better it would be, the more likely the teachers would be comfortable going back to school, et cetera. But the realization was that in most places, they would not be able to get the teachers vaccinated in time for the schools to get in time that we needed to get the schools open. So the idea was to do it independent of vaccination, but to have vaccination be in a parallel track.
Right, because it's an additional safety measure, obviously. Just for folks to understand some of the comparisons to what's happening in other counties, I know Yolo County, which is a county that also has UC Davis. UC Davis has been absolutely crucial for testing and vaccination. They only, as of I believe this morning, it might have been yesterday, started their 75 and up vaccinations. So we've been doing that already for more than a week. And I think that we can look at different counties, and just like here, there's been decisions to move around in a tiered system based on what the county felt was necessary to do as far as vaccinations. So, you might see one county doing agriculture already, but they may have skipped something else. And so it's not exactly a perfect parallel to compare ourselves to other counties. But I do agree that at 10%, that overall in comparison to other counties, 10% is good. And I hope that we can keep that going. Supervisor Pyska brought up something, and others have chimed in a little bit on it. And right now, the way that we're doing things is by contacting individuals. So if you work at a school, your school has contacted you saying, if you want the vaccine, please go ahead and let us know. We'll get an appointment for you. If you happen to be on a program at the senior center and you fit the age range, please go ahead and make an appointment. Or they'll call you to see if you want to make an appointment. And I think that I want to make sure that this is a conversation as a whole, especially for the ethics committee. Those who are truly vulnerable and disenfranchised are not a part of any program. And that's been slightly mentioned. And I want to make sure that we find a way to be able to access those folks, because right now it's only if you're a part of something, and some people are very much alone and not a part of something, and they're still super vulnerable to what could happen to them, and also very fragile because of their physiological and health state that they have. So just trying to find ways to do that. I really appreciate the vaccine plan that was written out and spelled out step by step. I am in favor of that moving forward. I am curious, as of today, when the state, possibly today, I don't know if it'll be today, you stated today, I know it's coming, when the state comes out with its new vaccine tier plan, will you be readjusting what you just showed us based on what the state is, or what do you anticipate will happen with this new plan? Because their new plan, from what I can tell, they still want to prioritize educators in certain sectors, like emergency health workers and healthcare workers and so on. And then afterwards, once they're done with those top priorities, their idea is to just break it down by age. We'll see what the specifics are when it comes out, but that's been the conversation in our CSAC calls. What is your anticipation in changes to what you just showed us? Will you make the changes to match what the state is offering, or are you looking to the ethics committee to provide those changes?
We are pretty much obligated to align with the state's guidelines, but the one piece you're missing in the way you sketched that out was, yeah, there's going to be the tiers with the older folks and some of the essential workers, and then there's going to be what Supervisor Scott was talking about, the people with chronic medical illnesses that fall into certain categories that are very high risk if they get COVID, and then we'll go into the age-based tiers. So, basically, we will align with the state guidance. We have to. There is some, variability within some of that, and that's what the ethics committee will help with. Some of that is to have these discussions about, should the people that are provide the food at the senior centers, how much of a risk are they at, and how do we weigh all that out and figure out that they should be in front of somebody else. And, those are just complicated discussions. And that's where the committee is going to help. But overall, we're going to align with what the state says to do.
Okay. My last thing is about help from the state. I know that you and I had a discussion that the state was sending us folks. Have we received those folks to help with the vaccination process? Because I also know as of yesterday, the National Guard has started to help in certain counties to provide vaccination support. Have we received anything from the state yet, or are they still on their way?
Supposedly they're coming this week.
Okay.
And then they'll need to be trained and kind of onboarded. But, and we're, so the help question is a gigantic one. You can imagine to vaccinate a couple hundred people a day requires a fair amount of staff and support. And, we're getting that from a bunch of different directions and all these appointments require a lot of staff. So, there's been a lot of the county departments have been helping. Other folks in the community have been helping. A lot of the vaccinators are retired docs, retired nurses, and we've been very fortunate. People are showing up. Still, it requires a fair amount of coordination and kind of oversight, and that's what we're just kind of scrambling to keep all that in place.
And then just one last thing, don't mean to harp on the disenfranchised or the truly vulnerable, but let's not also forget that there's a large, I believe in the city of Clear Lake, it's 21% of the population is disabled. Let's make sure that remember also the disabled who may not have the simple access to some of these things as well. Tough conversation, but I appreciate the forward progress in getting that conversation started. And also the transparency level of the plan written out. Will that be posted onto the website?
Mr. Chair, if I may, yes, I was thinking that this committee should have a web page with that information on there. We do need to clean up the document and get some of the page breaks out, but then we can post updates.
And again, I'm sorry to ask, but the main COVID-19 page under vaccine, all there is a video to talk about the vaccine, which was an interview between Dr. Sharon, I believe it was, and Matthew Rothstein from our administration office. If there was also a link to the actual vaccine page versus having to find it in all the menus at the top. If that can definitely be put on the webpage for simple finding, that would be great. It's got good information in there.
Thank you, Mr. Chair. Matthew Rothstein is here and listening and probably will be on it before we're even done. But if not that soon.
Okay, and that's all the questions I have. Any further questions from Supervisor Pyska? I'll get to you, Chris.
So thanks for that information on the school opening, and I'm on the reopening committee for Middletown Unified. What are you going to be looking for the safety plan? Are you going to be looking for like gradual openings with cohorts, or a hybrid model, or a full opening? What's your expectation for that if we're getting to the point where we can start to look at those things?
This is really not my, the schools, so there's very clear guidelines from the state done with the public health folks and the State Department of Education. And all the superintendents around the county have been very involved in this. And so your superintendent in Middletown's done a great job. He's been very engaged with this. And so, the plans are good. So it's not going to be me saying like what I need for the school to open. It's going to be, are they complying with the safety recommendations from the state level? Do they have the procedures in place? And they all know what those are. And they've been doing good work to get that as reasonably as can be done in the context of their setting. So they just need to submit it to me, and if I have any concerns, I'll get back to them, but otherwise they're good to go.
Thanks for that. Yeah, I know the superintendent understands that, but I just wanted some clarification from you, and I appreciate that just for the general public, because there is an expectation that the schools can just open all the way up. And
the guidelines are, just so if people are interested in reading them, they're long and very, very precise. On the state website, on the California Department of Public Health website, there's a school reopening guide that goes into a lot of detail, and there's checklists and all kinds of stuff. So the superintendents in the schools have been very, very involved in doing the right thing and preparing for this. And so I think everybody should feel very proud of how the school districts have been moving forward with all this and kind of really doing due diligence going forward.
Thank you. Supervisor Crandall?
Yes, I got some feedback with your question. I'm not sure if some of it applies to Supervisor Pyska's. The feedback is all schools have a school site specific protection plan that is attached to their COVID plan. Sutter and Mendo are nearly done vaccinating teachers. Mendocino College started vaccinating teachers earlier than the Office of Ed, and Sutter's nearly done. So that was from Rob Young that works at the Office of Education. He gave me that feedback as he's watching. So I don't know if that answers I just wanted to give that feedback.
Okay, thank you very much. If there's nothing,
Mr. Chair,
yeah,
I had one more comment. And Dr. Pace, just for, I know we have a large veteran community here in Lake County, obviously, and our veterans are very important to us. Does the VA have a different supply line for our veterans in the county? Where do the veterans fall for Lake County? Is that under private medical or under VA program? Just a question.
I'm not sure. I'm not aware that there's any VA supply coming into the county.
Okay.
So that's a good question. I'll check on that.
Thank you.
Thank you for the question, Supervisor. Let's go ahead, Jake, let's go ahead and open up the Zoom room for public comment. If anyone has any questions or comments for this item on the update for COVID-19 and our vaccination process.
All right, I've sent a mute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Melissa Fulton, CEO, pardon me, Lake County Chamber of Commerce. So I have a few points that I wanted to cover. One of them has to do with the volunteers that you need, Dr. Pace, to fully staff these vaccination points. And as would happen, Bernie Butcher from the Blue Wing in Tallman stopped in here just as this meeting was starting. And he said that he received his vaccination because they live part-time in the Bay Area in San Mateo. And they had a system set up where they had a lot of community volunteers, or at least staff, who were directing traffic, who were doing all of the ancillary duties necessary for a very organized procedure. And so I'm just wondering, and forgive me if I've missed this, but I'm wondering if we could have a vaccination volunteer staff menu, very brief, which outlines what you need the volunteers to do. Because I think we have a lot of people in Lake County who would step up if they knew specifically what they were being asked to do. But I think it's a possibly a broad misconception in the community that when you're asking for volunteers for vaccinations, that they think they have to be medically licensed or retired nurses, doctors, so on and so forth, when in fact we know that a lot of the people that you need to coordinate these vaccination clinics, if you will, especially if you go to a drive-through, don't need medical training. So is it possible that the health department could supply the local media, all of our business associations, so we can publicize that, exactly what those needs are for the volunteers, what they're going to be asked to do? I think that could help us get more volunteers. So that's one question. Is there something you can send me?
Well, yeah, that's a great point, Melissa. Thank you for bringing that up, because you're right. The clinical people is the smallest need. We've got a bunch of folks that are really dedicated and are really helping out right now that are, it's great. They're doing a great job. And, but we do need help doing a lot of other things. And as we shift over to the drive-through, we'll probably need even more. And so the way it has to be done, though, is people have to sign up and do some paperwork to be a registered volunteer with the county, so that, you know, insurance is covered and all that kind of stuff. And so if people are interested, they should just send a note into the MOAC, and then we'll refer it to the right person. But it's really, there's a lot with everywhere from disinfecting the chairs where people sit after they're done to doing data input in the computers. So if you're good with that kind of thing, to traffic control and crowd control and set up and breakdown. So there, you know, there's a lot of stuff, as you can imagine, with hundreds of people coming through a building.
Well, I appreciate that. And I think that the broad community who can communicate with, you know, all of the businesses, a lot of the retirees and whatnot, if we had that menu, rather than send them to you and your staff have to in turn forward that information. And I see Carol raising her hand.
Yeah, I just wanted to add in there that all of this is very actively being worked on. We're at a turning point here with vaccinations where we're likely to change our approach and make it a lot bigger. But we're absolutely working on plans for volunteers and more disaster service workers and support from the cities, et cetera. So many moving parts and all in play, and we won't forget you.
And Ms. Fulton, your 3 minutes are up if you'd like to just wrap it up.
Well, I'm just wondering, are we anticipating this potential rise in cases due to the new strains? Is that something? And I will send Dr. Pace the rest of my questions, because several came up this morning. And I do know that there are a lot of people working on a lot of things, but I think those of us in the public can assist in getting those volunteers for you fairly quickly as long as they know what they have to do to qualify as a volunteer. So thank you for your time. I appreciate all of this information, and I look forward to hearing from you.
Thank you. And Dr. Pace, I know you had already talked about the new strains, but if you can just repeat again what you know of the possibility, the issues with
Of the variant?
Yeah.
Well, yeah. So can you hear me? It seems like
Yeah,
it's breaking
we can hear
up.
you.
It's let me call in.
We can
Can you hear me? Okay. Okay. The concern about the variant is very much unknown. I mean, this is very early, but over the last couple of weeks, I was sort of kind of counseling that we thought this was the worst it was going to be, and things were going to gradually get better now, and we were looking at the kind of the light at the end of the tunnel. Now, because of some of what we're seeing in other places around the world, we're not sure that that's going to be the case. So this is nothing imminent, but it's moving fast in some places, and the potential is this could be a real problem in the coming months. And so I think the bottom line at this point is if you're concerned about this, pay attention to the news, and I'll be reporting on it, but also just be particularly careful with your masks and probably upgrade your mask at this point, and don't let your guard down in terms of mixing with people from, a lot out in public. So.
Okay, thank you for that. Jake, anyone else in the Zoom room wish to make a public comment?
Kathy Toy.
Yes, Kathy, go.
Yes, thank you to all of you, Dr. Pace and the board. Dr. Pace, you commented earlier that if you had vaccines at the end of the day in some of the sites, that you were giving them out to people that had perhaps contacted you. I suspect probably begging for vaccine. How do you, as the officer, or is there a plan to make that availability more equitable? Like, I've heard this before, that there are leftover vaccines at certain sites. How do we deal with that as a community? How do we get on a list? Is there a list?
Right. I'm sorry. I probably said that in a way that was confusing. We have lists that we're working off of people that qualify under the current tier system. So it's not a free for all that people just make a line that will start vaccinating them, whoever they are. What we're doing is we've got this ongoing list of people that are in the group. So some of these ones that Supervisor Sabatier was mentioning that are not connected with the senior centers or with medical providers, or Supervisor Peiska was mentioning as well, that if they send me those lists, then we can have those available at the end of the day, and we reach out to those folks when we're in that part of the town. So the idea is that we're trying to capture the most people that we can. Some folks are falling through the cracks for various reasons, but that they still qualify and they should be in the front of the line as well. If we have these lists, we can try to either filter them into the appointment system or keep it at the end of the day and contact them to come in. So it's not really the way I probably made it sound, which is like, if you just hang around at the end of the day, you can maybe get one. We're really trying to work within the tier system.
Okay, thank you very much.
Thank you. Any other public comment?
I've sent another unmute request out to the Zoom room floor.
Thank you, Jake. Okay, hearing none, let's go ahead and bring it back to the board. Any further comments or questions?
Dr. Pace? Just a verification question. One of the things I heard we talking about was the different strands of COVID, and of course I've been hearing this in different, articles and in stuff on the news. But I just wanted to know if you knew the vaccination, is that something that will either hinder or stop the new strains from developing? Is that why it's so imperative that we ensure people get vaccinated? Am I on the right track with that?
Right. Yeah, it's a good question. So we're still learning about it, but what happens when there's very high transmission of the virus, the risk of mutation is much greater, and these more contagious strains can spread more quickly. So partly what happens is if you get a lot of the population protected with the vaccination, it slows down the whole transmission, and so it just slows the spread of these things and potentially gives us time to get in front of it. So the strategy right now, they're talking about it, it's like a race against time. So the more people we can get vaccinated quickly, the more likely we are to really slow the spread of these new strains and kind of keep it under control. And the other piece of that is that at this point, we don't know how much these strains are going to be able to escape from the virus, the vaccine. So how much the vaccine protects against some of these new strains, probably somewhat less for some of them, whether it doesn't, it probably offers some protection, but maybe less than for the original strain.
Thank you. Thank you very much.
Thank you. And Dr. Pace, I do have a final question for you. I had asked about industry sectors like healthcare last week about what percentage have agreed to get vaccinated. Because we know, like you gave us the total numbers of about 9,000 for 65 to 75, and another 4,000 or 5,000 for 75 plus. So we know approximately what our populations are that we're looking at getting vaccinated, but what percentage of some of those sectors that we've gone ahead and finished up or believe we finished up, there might be some trickling in of others who want to get vaccinated now, who feel more comfortable. Do you know what the percentage is for some of those sectors that we've completed?
Well, I think it's different in different, like in the hospitals, my understanding is it's been somewhere between 60 and 80%. And it tends to be, the doctors tend to be more, maybe the nurses a little less, and, and then folks that are environmental folks and cafeteria folks maybe less, so it's sort of like there's a little bit of a stratification in there. I think in the nursing homes, the staff in the nursing homes is somewhere around 50, 60%, something like that. And all the residents get it. They all get it. And a question came up the other day about if new admissions are getting vaccinated, new admissions to nursing homes. And it sounds like, the nursing homes each have pharmacy partnerships. The pharmacy is going to come out 3 times total to vaccinate. And so they'll pick up these new folks in when they come out the next time. So, I think different settings are different ways. Probably the alternative practitioners will be less interested than the conventional practitioners. And, so it's a very variable thing. But somewhere, I think pretty much what we're seeing is 50+% kind of across the board. And too often what happens is people decline it the first time, and then they see their friends getting it a couple weeks later, then they want to get it.
Right. Okay, thank you for that. And I just want to make a statement to the community. And there are, obviously, we've really described the problem that we have here. We just have a limited amount of vaccinations for a much larger population that wants the vaccination. It's not maybe everybody in our community, but it's still a much larger number that wants to be vaccinated versus what we have access to. Countrywide problem, statewide problem, not just a Lake County problem. But I've seen in our community people use their status and their positions and their knowledge of connection or their connections to other community members to get in front of others. And I want to call those people out. That is selfish. We are trying to get things done correctly. We are imperfect too, but we are trying to do better as we move forward and learn from the things that we've done. But to actually try to get in front of the line of someone else who is more frail than you and someone else who might be more likely to be impacted in a negative way by this virus, it is despicable. So please, your turn will come. Everyone who wants to get a vaccination can and will get one. It's a matter of time. Do not throw other people to the side in order for you to get up front. I just learning of some of the things that has happened, it disgusts me. And so please, let's make sure that we treat our neighbors properly, and that we look at the fact that we're looking at the big picture. It's not about you, it's not about me, it's about us. And we need to do what we can to make this right. So please be patient, we will get to you. Any final comments from anyone else before we move on? All right, Dr. Pace, thank you very much for today's report. We will see you soon. Thank you so much.
Thank you.